Hi, my name is Brad Kegley. Today I'm going to be inserting an NG tube. First thing that I'm going to do is check the doctor's orders and check what all I need to get. I'm going to go into the supply room, gather all of my supplies, which have everything right here. And I'm going to go to the patient's room, we'll perform hand hygiene, put on my gloves. While I'm in the patient's room, I'm going to identify the patient, their name, date of birth, and I can check the name tag on their arm as well. And first thing I'm going to do is I'm going to assess the patient. I'm going to let them know that I'm going to be placing an NG tube today. I'm going to assess the nares, the patency of them. I'm going to check any blockages in the mouth. I don't see any, and determine that the left nare is the best option for the placement today. I'm going to start off. I'm going to measure the NG tube. It's going to be measured from the nostril around the ear down to the xiphoid process. This is going to be taped right here to mark how long it needs to be. At this point, I'm going to get my lube. I'm going to lube the NG tube. I'm going to have the patient at a high Fowler's position. I'm going to have their head against the back of the bed. I'm going to start inserting. It's going to insert until there can be a little resistance met. I'm going to, at this time, check the mouth, check the back of the throat, make sure that there's no coiling, which there is not. I'm going to then have the patient bring their head forward. I'm going to have them sip on the water continuously. And at the same time as this, I'm going to be pushing this down, going down, all the way until I get to the piece of tape, which on the mannequin it will not go that far. And this time I'm going to place a piece of tape right here to secure it. Tape is not sticking. Alright. At this point, I'm going to check the placement of the NG tube. So I'm going to hook up here. I'm going to pull out 15 to 20 milliliters. And test the pH first. Should be right here. Test the pH, and it is less than 4, so it is acidic, and that is another indication that we are in the stomach. I'm going to hook this back up. I'm going to listen to the left upper gastric area as I push this back in. And you can hear a swishing sound. It means the placement is good. I'm going to unhook here. And I'm going to secure the NG tube to the patient. At this point, I can hook this up to suction and have it on low intermittent suction. And at this point, I'm done inserting the NG tube. I can take my gloves off, clean up all my supplies, and proceed out of the room, where I'm going to document the patient's name, the procedure that was done, how the placement went, and how the patient tolerated the procedure. And sometime later, the doctor has ordered for placement and make sure that NG tube is still functioning properly. So I'll come back into the room, I will check the patient's name, date of birth, make sure that I have the right patient. And I'm going to disconnect the tubing from the suction. I'm going to have my supplies already here. I'm going to take a plunger. I'm going to draw up 30 mLs of water. I'm going to hook this up here to the tubing. And I'm going to push in the 30 mLs of water. And then I'm going to try and get back 30 mLs of content. If you do not get back 30 mLs, you would repeat this process until you do finally get back 30 mLs. And once you get back to 30 mLs, you would rehook the suction back up, the intermittent suction, and at that point you would go back out of the room and document that the suction is clear, and document the patient's name, the time that you did this at. And also one other thing would be you would have a rubber band that you would connect around the tube with a pin, and also help secure the tube, which we don't have at this time. So that concludes the NG tube.